Greetings from Spain. Thank you very much for watching this presentation regarding the relationship between obstetric history and recurrent urinary tract infection. I have no affiliation to disclose regarding this presentation. Urinary tract infection affect more than 50% of women. Relationship between recurrent urinary tract infection, estrogen status, and pelvic floor function is known, but not the relationship between obstetric history and recurrent urinary tract infection occurrence. Our objective is to know the prevalence of obstetric history in women with recurrent urinary tract infection and to investigate if there is any relationship between the obstetric events and the occurrence of recurrent urinary tract infection. We perform a multi-center observational case control retrospective study in 714 patients followed in the urology department. We distinguished two groups. Group A, women with RUTI, and Group B, women without RUTI. We study age, obstetric history, gynecological, surgical background, estrogen status, urine cultures. Mean age was 71 years, 71 years, and the age was lower in Group A. Nulliparous were more frequent in Group B. It means not recurrent urinary tract infection, compared with Group A. Ectopic childbirths were more frequent in Group A compared with Group B. Dystotic childbirths were less frequent in Group A. Miscarriage was more frequent in Group B. Regarding gynecological surgical background, hysterectomy without anesthectomy, there was no differences between the groups, but hysterectomy with anesthectomy was less frequent in Group A. In multiple regression analysis, we found that age has a direct correlation with appearance of UTI, in contrast with BMI that had inverse correlation. Women with recurrent urinary tract infection had a more frequent history of ectopic delivery. Nullipary, dystotic delivery, and hysterectomy with anesthectomy are more frequent in women without urinary tract infection. Most prevalent obstetric antecedent in women with recurrent urinary tract infection is ectopic delivery, associated with good health, but the relationship was not significantly. In women with more deteriorated health status, the mean background associated with recurrent urinary tract infection is dystotic delivery, with the condition of concomitant urinary incontinence being much more prevalent. In the study of Angelo Goose, they conclude that dystotic deliveries are related to pelvic floor dysfunction, while in our study we observed there was a negative correlation which could indicate dystotic delivery is related with the less presence of recurrent urinary tract infection. In a study by hand, dystotic deliveries have been found to be generally associated with poor functionality of the general pelvic floor, so data obtained is surprising compared to previous literature. In our patients with past history of hysterectomy with anesthectomy could be more asked about symptoms associated with hypoestrogenism by their healthcare providers, and therefore by the treated with topical estrogen. But this fact has not been studied in the sample and could bias the result of the multivariate analysis. Hysterectomy with anesthectomy was more frequent in women without urinary tract infection. Another factor that could influence the result could be that patients in Group B were older than in Group A, and for this reason hysterectomy with anesthectomy could have more indicated by their gynecologists following the trend of the recommendation of the last century. Most patients in the control group were nulliparous. It could condition that the patient in this group have a fitter pelvic floor without muscle avulsions, being more prone to protect the genitourinary tract against urinary tract infection. In conclusion, nulliparity is more frequent in women without recurrent urinary tract infection, while ectopic births are more associated with recurrent urinary tract infection. The most prevalent gynecology obstetric history in women with recurrent urinary tract infection is ectopic delivery associated with a good health status. Thank you very much for your attention.